I'm Dr. Taggart with the Kirkland Thyroid Institute, where we specialize in treating thyroid disorders which have not responded to traditional medical care. I have advanced training in neurology, functional endocrinology, and functional neurophysiology. So with this training, it allows me to pinpoint the exact cause of your problem and help you set on a corrective course so that you can get better. Today, we're going to talk about the autoimmune thyroid. The autoimmune thyroid we talked about in our last DVD has to do with your immune system kind of going haywire and actually attacking your own thyroid gland. And if it goes on long enough, it can actually destroy your thyroid gland. That's not a good thing. Typical symptoms of autoimmune thyroid can be low thyroid symptoms, or it can be a combination of low and high thyroid symptoms. There's specific tests that we talked about in the last DVD that need to be done to determine if you have that. So today we're going to talk about what triggers the immune system to start attacking your own body. And that's very important that this be looked at, because if we find out you have it, we have to find out what is causing it, and we have to actually do things to cause your immune system to become more imbalanced so that your immune system relaxes so it stops attacking your tissue. And one of the main things we're going to be looking at, there's really kind of two things. We're going to be looking at food sensitivities. Food sensitivities are going to create an inflammatory response in your body, and it's actually going to set off your immune system, because your immune system is going to try to deal with the effects of the food sensitivity, their food allergy. It's going to cause the immune balance. So when we are suspicious of this in our office, we do specific blood and also stool-based tests to determine if you have a food sensitivity. And the big one we're looking for with thyroid is gluten. You've probably heard about gluten. Gluten is something that if you have a sensitivity, or you may have a genetic issue where you can't tolerate gluten at all, and this is a big trigger that sets off the autoimmune thyroid. So specific tests that we do will determine if you have a gluten or a wheat problem. It will also determine if you have maybe a dairy or milk issue. We also test you for any problem with eggs, yeast, and soy. Those are the big triggers, the main food allergies that will actually cause your immune system to start attacking itself. Now, in addition to looking at food allergies, we're also going to look at chronic infections that you may have that have not been detected or not been addressed properly. When we do a blood test, we're looking for low white blood cell count. And again, we use the functional range, not the pathological range. So often these problems are missed by a medical doctor. We use a more specific functional range. So we're looking for low white blood cells. We're also looking for other parts of the white blood cell that may be low, like neutrophils, monocytes, eosinophils, basophils. So if we see a shift in there, we'll be suspicious that you have an infection that's been going on long-term in your body, and we need to find out what it is. It could be a virus, it could be a yeast, a fungus, it could be a parasite, and then the specific tests that we'll do will determine if you have that. And then what we'll do is we'll put you on a corrective course to get rid of the infection. That's going to cause your immune system to relax, and it's going to stop making those antibodies to attack your thyroid gland. Now, in our office, what we're offering for people who are serious about getting better is we offer 2 free visits. In these free visits, I'll meet with you, I'll discuss your case. We may look at your old medical records, look at old blood tests that you have, and I'll do an examination on you, and then on a follow-up visit, I'll sit down with you and say, based on what you told me, based on some old lab tests, here's a test that we need to do to determine what's going on, and here's the corrective course of action that we need to do to turn this around. Because if we don't turn this around, unfortunately, you're going to continue to go into a further lower and lower downward spiral of poor health, and that's just not okay. We can't have that. So I'm going to highly recommend that you give our office a call at 425-821-1101. I look forward to meeting you, and we can definitely help you.